Hello, I'm Mike Cudlis. I'm the Chief Academic Officer at the American Society of Radiologic Technologists. We're going to be speaking on medical radiation and overview of the issues important to technologists. Once again, I'm not a CT technologist, but we do have a great deal of CT and other type of survey data that we collect at ASRT, and I think there's some real interesting numbers in here as we kind of run through these quickly and look at how important radiologic technologists see radiation safety and what kind of training and what kind of issues are important to them. So first of all, before we really get into it, I just need to state that CT technologists, or all technologists, see radiation safety as one of their primary goals, primary purposes. They have a great deal of training in radiation protection, and they see themselves as the patient advocate when it comes to radiation safety. We're really the last line of defense, if you want to call it that, when it comes to radiation protection. You can have all of the protocols and all of the policies in place that you want, but it's the technologist at the end that is the one performing the exam and determining how much radiation a patient is going to get. And I can tell you that radiologic technologists take that as almost a sacred trust and something that they're very, very concerned about. So for the radiologists, medical physicists, and others out there who are concerned about radiation protection, I can tell you that a technologist is going to be your best friend when it comes to protecting patients and reducing dose as much as possible. So, going back to the next slide, the objectives of this quick talk here are to describe the educational preparation of RTs related to radiation safety and to define the changes that have occurred in the number and distribution of certified CT technologists. As I stated in the other lecture earlier, certification is one way that we feel technologists gain that foundational knowledge, not only in radiation safety, but also in protocols and in procedures so that things aren't having to be repeated and radiation doses are being doubled. Okay, so quickly let's look at the educational background of radiologic technologists. On this slide we're looking at radiation protection as a component of the curriculum. Even though radiologic technologists in their entry-level curriculum might not be given a lot of education related specifically to CT, they're given a great deal of education as it relates to medical radiation and reducing radiation dose in diagnostic imaging. So a lot of the skills that they learn in the entry-level radiography curriculum are transferable to the CT environment as well. Time distance shielding, same types of X-ray interactions with matter, that sort of thing. Next slide is the ASRT practice standards, and I'm not going to read this whole thing, but I will direct your attention to the last paragraph here and the first two sentences, and we'll read those to you. Radiographers must maintain a high degree of accuracy in radiographic positioning and exposure techniques. They must possess, utilize, and maintain knowledge of radiation protection and safety. Once again, this is a key component. This is the preamble, if you will, to the ASRT practice standards. And there are specific standards that speak to radiation safety, but radiation safety, radiation protection is really a core component of who we are as radiologic technologists. The next slide just shows some of the objectives when it comes to radiation protection and the concepts that a radiologic technologist is expected to master before graduating from an entry-level program. And as we stated in the previous talk, the primary pathway for someone to become a CT technologist is for them to be a radiologic technologist, a diagnostic radiographer first, and then to move into the CT arena after that. Okay, this slide talks about educational programs and the personal demographics of instructors in educational programs. So why is this important? Well, these are the people teaching entry-level radiographers about radiation safety and about procedures and medical imaging. Not surprisingly, the number one discipline in which educators are certified is radiography, and number two is mammography, but closely followed behind is CT. So 16, almost 17% of the educators out there are also certified in CT. There may have been a lot of other educators that perhaps didn't, or perhaps worked in CT before they went into teaching, but they're not certified. But still, 17% is a goodly number of people certified in CT that are teaching in an entry-level program for radiography. So that tells us that CT is quickly becoming very important in the entry-level arena. Okay, let's look at the landscape for CT technologists. Just some quick background and some things that are changing. The slide entitled Staffing Levels shows us the different disciplines, and this is from one of our staffing surveys, but you can see radiography, CT, and mammography are the top three disciplines that people are working in. CT has very quickly risen up that list and is kind of knocking on the door of diagnostic radiography. 5-10 years from now, as we stand here, is CT going to be an entry-level modality? Are people going to go straight into CT and bypass radiography altogether? I'm not sure, but CT is becoming more and more important in the medical imaging world, as we all know. One of the things when they do our staffing survey is we estimate the percent of unfilled positions out there. And right now, CT is right in line with radiography with a 2% vacancy rate, which, if you think about it, is probably just about zero. With the amount of people that might be moving from one part of the country to the other, that just having a 2% unfilled FTE position is a relatively small number. The next slide is graphically depicting what has occurred in medical imaging over the last 8 or 9 years. If we were giving this talk 10 or 12 years ago, we'd be talking about a big shortage in medical imaging. That shortage has essentially gone away, and we don't like to use the word glut, but for lack of a better term, there are more positions, or more people seeking positions than there are open positions in many parts of the country. There's still some open positions in certain parts of the country, but you can tell from this chart that CVIT, so cardiovascular interventional technology, and sonography are still at about just below a 4% vacancy rate, but CT, MR, radiography, and nuclear medicine are down around the 2% mark. So if there is an open position in CT, it's being filled very rapidly. The next slide is we'll just look at real quickly because we looked at it in the other talk. This is also a shifting status of CT technologists. 4 years ago, 55% of the technologists practicing in CT were not certified. Today that number has dropped, or that percent has dropped down to 37%. Even though there's more technologists practicing in CT, there are fewer of them that are not certified. So that's something that's definitely changed very quickly in the last 4 years as well. And we hope that trend continues because, once again, we feel that certification is a good foundational measure of competency in CT and other modalities. Okay, let's look at continuing education needs and what technologists are telling us that they need out there in the field. Every 5 years we do a CT needs assessment, and this is our latest CE needs assessment, where we send out a survey to technologists and ask them, what areas would you like to see the ASRT and other organizations create continuing education products for you? You can see that the top three are anatomy and physiology, digital imaging, and future trends. And right there, smack dab in the middle, at about 21%, is safety. Now you could take this one of two ways. You could say, well, technologists aren't interested in radiation safety. That's not how I would interpret this graph. I would interpret it as the fact that they felt they got a really good foundational education in radiation safety in their entry-level programs, or as they were being trained on the job in CT and other modalities, and that there's other things. You could really consider anatomy, physiology, digital imaging, pathology, all that sort of thing, also to be a key component of radiation safety. If you don't know pathology and if you don't know your anatomy and physiology, and you create a poor exam that has to be repeated, you're doubling the dose for a patient. So I think all of this is really kind of tied in with radiation safety, but pure radiation safety, I think most technologists, if you ask them, would feel they had a pretty good handle on what the requirements are to provide good, safe procedures for patients in the imaging area. The next slide is kind of the same question, but specifically of CT technologists. So once again, you can see that pathology, anatomy and physiology, and future trends are the top three topics that CT technologists would like to see covered. And safety is a little further down the list at about 17% of the technologists feeling that they need CT, safety, CE. That's hard to say. Okay, the next slide is a survey that we do of educational programs. And this is a question that we ask of program directors. So when participating in professional development opportunities, what topics do you primarily pursue? You can see that radiation safety is fourth on the list there. Not surprisingly, education and instructional methods is number one, but safety is still something that, that instructors are looking for. Once again, I think they feel that they have a good handle on radiation safety as it applies to medical imaging as well. Okay, going forward, let's look at radiation safety going forward. In our enrollment survey of 2011, and this is something that we do every other year, so we're actually right in the middle of an enrollment survey right now. We asked the question, we actually asked a lot of questions on this survey about radiation safety of program directors and instructors in educational programs. For which of the following disciplines do you provide specific radiation safety information as a portion of your radiation safety course? I'm actually a little surprised that radiography isn't 100% because I think almost everybody does provide radiography education, but we also surveyed radiation therapy programs in here as well, so that's why they probably don't focus on radiography. But you can see that more than half of the programs provide specific education in CT radiation safety. So that number is, well, we're going to track that number. This is the first time we've asked that question, but we're going to expect to see that number increase over the years as we do this survey. The next slide talks about who teaches radiation safety in your program, and I'm not sure if this surprises anybody. It doesn't surprise me that almost 95% of the programs out there, a radiologic technologist is giving the education. Once again, the radiologic technologists feel that they are very competent in this area, that this is a core component of what it is that they do. So it's not surprising that a radiologic technologist is teaching future radiologic technologists about radiation safety. You can see where the other medical physicists, radiologists, and radiologist assistants come in as well. The next slide talks specifically about CT in a program. Who teaches radiation safety for CT in your program? Once again, it's radiologic technologists more than half the time that are doing that training. Okay, the next slide talks about CT shielding in a survey that we did last year. And there's some really interesting data in here. This is a somewhat controversial topic. Should you shield, should you not shield? In what cases should you be shielding in CT? There are, across the top, you can see that there's 4 different types of institutions. There are institutions that do adult and pediatric. I'm sorry, there's 3 types of institutions. There's institutions that do both adult and pediatric imaging. There are institutions that do adults only, and there are institutions that do pediatric only. So answering the question, does your facility use shielding on all pediatric exams? For those, for adults, the answer is yes, 22% of the time. For pediatrics, it's yes, 61% of the time. A little bit lower at 47.4% of the time for institutions that are pediatric only. You can see there that there are some institutions, especially the adult-only institutions, that 20% there that don't shield at all, some that only shield upon request, and sometimes, and then the shielding that are based on specific circumstances there as well. The bottom chart shows who decides if the patient is to be shielded during the CT exam. You can see overwhelmingly the number one person who decides whether shielding occurs or not is the radiologic technologist. So in some cases there are protocols that are probably written by the radiologist or the physicist together, but in most cases, once again, it's the radiologic technologist that's the frontline person deciding whether to use shielding or not. The next slide continues from the CT shielding survey. Does your facility have radiation safety policies specific to CT? You can see that in pediatric-only facilities, 90% do. In adult-only, it's about 67%. Unfortunately, there's some people that don't know if they have a policy. That's kind of a disturbingly high number there, but that's something that we definitely want to work on here at the ASRT. And do you document dose? In a lot of the pediatric cases they do, and even for adults the number is relatively high. So that's good that we're starting to collect that data. Okay, the next slide talks about the patient knowledge survey that we did in 2011. And these are questions that we asked of radiologic technologists. So when implementing new technology, did you feel that you were adequately prepared to begin using the technology? 91% said, yep, they really felt that they were prepared when the new technology came in. 9% felt that they were not adequately prepared. The next slide is from the same survey, but what do they think the knowledge of the patients are? From your perspective, what percentage of patients know they will receive ionizing radiation during their medical imaging and radiation therapy procedures? 63% of the technologists surveyed felt like patients understood that they were getting ionizing radiation. So we've got some work to do there for patient education. And from your perspective, what percentage of patients know that you are educated in radiation safety, dose management, and patient care? Only about half of the technologists surveyed felt that the technologist, was the expert when it came to radiation safety and radiation protection. So once again, we have some work to do there as well. The next slide from the same survey is asking how we can help. And by we, I mean the question was related to ASRT, but it's really everybody. It's the ASRT, it's vendors, it's radiologists. What can we do to help provide additional education to patients? Overwhelmingly, a fact sheet or a brochure that could be handed out to a patient in a clinical setting is the way that technologists feel that this information should be given to patients. Websites and talking points didn't do too bad in the survey, but I think this points to the fact that CT departments tend to be very, very busy places, and there might not always exist the time to provide the quality patient education that we'd like to provide. So brochures and fact sheets would definitely help to spread the word to patients, so that when we're talking to them, we can be a little bit more efficient in what questions we're answering and what we're telling them. Okay, so radiation safety and CT, the team approach. One of the nice things about this conference is that there's a lot of different people speaking at it, and all speaking pretty much on the same topic. But we have national organizations such as the ASRT, the ACR, ASRT, that are all really concerned about patient safety and decreased patient dose. We also have national consortiums such as Image Gently, Image Wisely, that are concerned with reducing patient dose. We know the manufacturers are. We know that educational institutions certainly are. Hospital management is, individuals, and hopefully we can get the government to get on board with us as well. There doesn't seem to be as much legislation out there related to radiation protection as perhaps there could be. Notice I didn't say should be. I think that medical imaging, radiation therapy is doing a good job of policing our own, and if we can do a good job through conferences like this of reducing patient dose, we can probably keep the government from having to come in and pass legislation to reduce patient dose as well. But the manufacturers, just to touch on that once again, very, very critical component in terms of the training that goes on and in terms of making sure that everybody knows what it is that they're doing. So, medical radiation, an overview of the issues important to technologists, just to wrap up real quick. Once again, I think technologists definitely see themselves on the front lines. They are critically concerned about radiation protection and radiation dose. And anything that manufacturers, radiologists, medical physicists can do to assist us as we work with patients in that team approach would be greatly appreciated. Thank you.